Hi and welcome to Lessons from the Grand Rounds. In this short video, we are going to discuss about a concept in multiple myeloma. So the role of thromboprophylaxis while we are giving some therapy in multiple myeloma. So let's go to a clinical case to correlate better. So we have a 64-year-old female who is type 2 diabetic hypertensive. She was initially diagnosed after lower back pain and also the right thigh pain. On the routine examination and the investigations, we found out there is a multiloculated lytic lesion in the femoral shaft. She was asked to be kept for some stabilization and immobilization for the same to avoid fracture. She was also advised to get operated, but then she chose to be treated as a conservative approach. So this patient is diagnosed as a case of newly diagnosed multiple myeloma with ISS3, RISS3 with fish showing TP53 in more than 40% of the cells. Um, and now this patient was first offered as therapy as DARA VRD, but then she chose VRD due to financial constraints. So we started her on Borvis, lenalidomide, and dexamethasone. She has completed first cycle. She comes to the emergency with complaints of right leg swelling, pain. The initial investigations and the evaluation on the USG Doppler showed a right venous popliteal, right deep venous thrombosis, right lower limb deep venous thrombosis. So when we check the medication what she is receiving, she missed ecosprin or aspirin overall the whole month. And then, so we have a case of newly diagnosed multiple myeloma started on VRD therapy, missing aspirin, and this patient lands up with right lower limb DVT. So, is there a risk of thromboembolic event in myeloma or while the patients are on therapy? So, yes. So, in cases of MGUS, there is 7% increased risk to a thromboembolic event, whereas with myeloma, we have 10% risk of thromboembolic event. So, the other risk factors of a thromboembolic event, which includes diabetes, hypertension, obesity, and they are same as a non-myeloma patients. So, the other thing is then when we are treating patients with therapy which includes immunomodulators, that is IMIDs, which includes thalidomide in the part of MPT regimen where you have uh, melphalan, prednisolone, thalidomide, or lenalidomide containing regimens, or pomalidomide containing regimens like VRD, KPD, or any therapy including LEN or this. So you usually supplement the patients with aspirin 75 mg once a day to decrease the thrombotic risk or to decrease the events of thromboembolism. So this is especially during the first 2 months of starting therapy. So let's see what are the proposed mechanisms of increased thromboembolic events in patients of myeloma or when the patients are on IMID. So the earlier report said that the M protein interacts with the platelets and there is increased platelet adhesion and aggregation, and this causes a thrombus. There was also a report saying that there are more increased fibrin monofibrils which causes more fibrin assembly and then a procoagulatory state. And then especially when the patients are on IMID, there is increased expression of there is some interaction with the endothelial cells and the endothelium, and there is increased expression of von Willebrand factor and factor 18, which eventually causes resistance to protein C. And this procoagulant state is classically highest during the first 2 months of the therapy with IMIDs, and also since the myeloma is newly diagnosed, and this is the period where we are more risk of thromboembolic event. The other risk factors which include which cause more of a procoagulant state apart from myeloma or IMIDs is first use of erythropoietin, especially very common use when the patient is anemic with anemia of chronic disease. The other thing is high dose dexamethasone whenever we are giving, and other drug is anthracycline. Use of anthracycline not very often we use it in myeloma patients. So this was all about the risk of thromboembolism or thromboembolic events in myeloma while the patients are also on IMID therapy. And I'll be putting a post where there are three images. First of them shows the trials and the studies which have been done while the patients were on um, lenalidomide or pomalidomide. The second one will show you the risk factors, and the third one will show you how should you manage or give thromboprophylaxis while you're treating with IMiDs, along with the other risk factors if you want to give aspirin or a limb ablation. So thank you.